First aid measures. Most of the times we follow safety rules. Even then sometimes accidents and mishappenings can take place. Children, while playing, may fall down and get injured. In your home, any family member may fall sick. In such an emergency, care for a victim of sudden illness or injury is called first aid. In our daily life, all of us must have the basic knowledge of first aid. For a variety of injuries like cut, bruises, burn, and stings, we need prompt aid before reaching to the doctor. In emergency, these steps can be adopted for the injuries. Burns. A burn is an injury to the skin caused by exposure to fire, hot liquids or metals, etc. Burns are classified according to the depth of tissue damage and extent of the burn. 1. First-degree burn or superficial burn. It involves only the surface of the skin, is characterized by reddening. 2. Second-degree burn. This type of burns extends beneath the surface of the skin and causes blistering and severe pain. 3. Third-degree burn. It causes charring and destruction of cell-producing layer of skin. Severe burns cause shock and loss of body fluids. A person suffering from third-degree burns should be hospitalized as soon as possible. First aid for burns. 1. Remove the source of burn as soon as possible. 2. If clothes catch fire, roll on the ground or wrap the victim in a blanket. 3. The burn area should be cooled immediately with cold water. A clean, cold wet towel can be placed on less serious burns. 4. When small swellings on the burnt area, blisters are formed, dip the affected part in water. Do not puncture the blisters. 5. On severe burning, cover the body with clean cloth and rush to the doctor. Cuts. 1. Wash the cut with soap water. Dust particles should be removed. 2. Cut part must be disinfected by antiseptic solution. 3. To stop the bleeding, apply pressure directly over the wound, tie a bandage, and if possible, elevate the bleeding part of the body. Bruises. 1. Bruise is an injury in which tiny blood vessels beneath the skin are ruptured, but the skin itself is not broken. The affected area swells and turns shades of blue, red, and purple as blood from the broken blood vessels seep into the tissues. 2. Swelling and pain may be lessened by applying either ice or cold, wet cloths to the affected area immediately after the injury. Animal bites and stings. Animals like snakes, dogs, cats, and certain insects may bite humans, which may result into dangerous consequences. Snake bite. The snake bites by non-poisonous snakes do not require treatment beyond cleaning the wounds. Bites of poisonous snakes require immediate first aid measures. Tightly bind the area to prevent the venom from spreading rapidly through the individual's bloodstream. The wound should be washed thoroughly with soap and water. The victim should be taken to the nearest hospital as soon as possible. Bites from other animals should be thoroughly washed and an antibiotic ointment should be applied. The victim should seek medical help and anti-rabies injection must be given. Stings. Bites from insects like fleas, mosquitoes, bees, etc. should be washed to prevent infection and cold compresses are applied to alleviate itching and pain. Remove the stings with the help of forceps. General precautions of first aid. 1. Do not panic or get frightened. Keep calm. 2. Do not crowd around the victim. 3. If the person is badly injured, immediately rush to the doctor. 4. While giving first aid, it is very important to know what not to do in an emergency. Wrong treatment can be harmful to the victim.